Hello, for my assignment, I chose to do my policy brief on EVALI and vaping-related deaths. So in order to talk about EVALI and vaping-related deaths, it's important to give some context to the issue of electronic cigarette and nicotine vaping device use. In 2018, a study found the prevalence of e-cig use among adults was 4.5%, and this was increasing each year. E-cig use among adolescents was also increasing. As you can see by the chart below, national trends from 2017 to 2018 for all grade categories represented almost doubled. So what is EVALI? EVALI stands for e-cigarette or vaping product use associated lung injury, and it describes individuals presenting at hospitals with respiratory injuries caused by electronic vaping devices. As of November 5th, 2019, the Centers for Disease Control has identified a total of 2,051 cases of Ebola in 49 states, with 39 confirmed deaths. So as you can see by this chart, provided by the CDC, beginning in about May of 2019, there's been an upward trend in reported cases of Ebola, and towards the end, it almost appears as though the chart is decreasing, but that can be accounted for in the lag time from hospitals reporting cases. So this is still increasing. So the root causes for Ebola and vapor-related death primarily is the use of nicotine or THC containing vapor products. And really it's the CDC believes it's the additives in these products, such as vitamin E acetate. And then among individuals presenting at hospitals with Ebola, vitamin E acetate has been detected in all samples of bronchoalveolar lavage, which is fluid in the lungs, indicating that the compound is likely associated with these injuries. But more research still needs to be conducted in order to be able to draw causal inferences and say that it is in fact vitamin E acetate and not some other compound. And then currently there's no federal regulation of THC vaping products, and THC is the psychoactive component of marijuana. So the root causes for electronic vapor device use, one, probably the most important, nicotine is highly addictive. Once people start and become addicted, it's very hard to quit. Also, these devices can use both nicotine or THC, and they can do so discreetly. A lot of the marketing for electronic cigarettes and nicotine vaping devices have promoted it as a safe alternative to smoking and even as a smoking cessation product. These products are also marketed towards youth and teens through the use of alluring packaging, often designed to look almost like food. And there's a variety of sweet flavored liquids for electronic vaping devices that appeal to teens as well as adults. And the ability to use these devices, kind of along with point number two, um, they're able to be used in areas where smoking is prohibited. They can be used discreetly, so there is that appeal to them as well. So currently in the United States, electronic cigarettes and nicotine vaping devices are regulated under the Food, Drug, and Cosmetics Act, and they've been regulated under that since about 2016. The FDCA does not restrict the use of additives unless they're known to be harmful. So that means unless there's any information out there to say that vitamin E acetate, for example, is harmful, there's nothing restricting it from being added to these liquids used to fuel vaping devices. Also important to note, marijuana products are federally illegal under the Controlled Substances Act, and this limits, of course, federal regulation, but also quality assurance at the federal level and efforts to determine product safety. As of November 2019, there are bans throughout the US on vaping devices and various products, kind of in light of Ebola and vaping related deaths. But really, this is a stopgap measure. It does nothing more than to kind of put a band-aid on the issue. It doesn't solve it. And as you can see by the figure here, This shows city, state, and county bans of nicotine vaping devices and products very recently, as of November 15th, 2019, and really it's not uniform across the United States. There's some cities, some states that are banning, certain products, some are banning flavors, but there's no real uniformity throughout the country, and most importantly, the majority of the states do not have any bans going on. So for my policy recommendations, first, I'd raise the age required to purchase and use nicotine vaping devices to 21 throughout the country. I'd also ban flavored vaping products that largely appeal to teenagers, and both of these would help to combat the teen vaping epidemic in the United States. As of now, I'd also institute a national ban on all vaping products until causality for EVALI and vaping-related deaths is determined, and this would really create uniformity on the bans going on throughout various counties and states throughout the country. I'd also set national policies for electronic cigarette packaging, use in public spaces, and methods for reducing adolescents' access, like proximity to schools where these products are sold, because largely these have been left to the states to decide. And then I'd amend the Controlled Substances Act and legalize marijuana to allow for research and quality assurance testing of THC vaping products. And this would be really following national trends for legalization, and with the ultimate goal of protecting the end user from harmful additives to these products. And then I'd amend the Food, Drug, and Cosmetic Act to anticipate future innovations in nicotine, THC, and maybe even unknown substances and their delivery systems so that they're researched thoroughly before they reach consumers. And then I'd amend the FDCA to also require any substance and delivery system, really new technology, to have a 5-year minimum toxicologic study conducted to evaluate the potential effects on human health that it has. So in summary, the incidence of EVALI and vaping-related deaths are increasing throughout the U.S. Policy measures must be taken to protect the health of the public and vulnerable populations such as teenagers, high school students, youth really, adolescents. And most importantly, these gaps in research need to be addressed if we are to be able to evaluate the safety of these products. And then policy solutions really need to anticipate future nicotine delivery mechanisms to prevent similar issues from happening in the future, lest we would want to find ourselves in a similar situation like what's happening now, where a product like e-cigs has been mass marketed and delivered to people all throughout the United States with very minimal research on the long-term health effects associated with it and the products it uses. And those are my references. Thank you so much.